Welcome to Spotlight. I'm your host, Jackie Hanton, and with me today is Liz King, the Health Officer for St. Clair County Community Health Department. Hi, Liz.
Hi, Jackie. Thank you for having me.
Yes, thanks for being on. So there's been a recent announcement of our most recent health report, if you will. That's the easiest way for me to think about it. Tell us more about that. You know, what does that encompass? How do we look as a county? What can we improve on?
Right. Yep. So the most recent announcement was that we're working on what's called a Community Health Improvement Plan, or we call it CHIP for short.
Okay.
So that improvement plan is really a roadmap for stakeholders to work towards public health priorities and improve the health of St. Clair County. So what it is a collaborative, a group of community stakeholders working together, narrowing down all that data that came out in our community health needs assessment earlier this year.
Okay.
So we look very closely at all that information and decide as a group, vote on all the priorities and narrow it down to what we're going to work on. And we've got it down to 3 different priorities at this point. And those have kind of shaken out after multiple votes. We have a consultant who leads this process for us. It is not just a health department driven initiative, it's a community coming together. So lots of stakeholders.
Okay.
At this point, where we sit, I think we're final on our objectives and priorities, and those are going to be, we're going to work on substance use and abuse, obesity, and healthy behaviors, you know, that prevent obesity, and mental health.
Okay.
So those are the priorities that the group voted on to really help transform the county into being healthier.
Wonderful. And how long, so you go through a needs assessment, you go through this process to come up with the priorities, like how long are those priorities in place for? Obviously these are, you know, years in the making of issues, they take years to tackle, so how long is that those focus areas in place?
They do take years to tackle, right? It's not something we can just fix even in 1 year. So it's about 3 to 4 years that a community health improvement plan actually stays in place. And then everybody works on those initiatives and reports back. So previous to this, we got interrupted by COVID and the pandemic. So we didn't move forward as much as we would like. And so we're really looking forward to sticking with the plan, reporting back on how we're doing on those initiatives, and moving the mark on the data to improve the health.
Okay, wonderful. Well, we're going to take a quick pause and we'll talk about the partners at the table.
Okay, thank you.
And we're going to take a quick break and listen to our sponsors.
Let North Star Bank, one of the most responsive, relationship-based banks in our community, partner with you to meet your financial needs. We have locations all across Michigan, so stop in and visit us today. North Star Bank, guiding the way. Member FDIC.
Welcome back to Spotlight. We're chatting with Liz King about our Community Health Improvement Plan. So, Liz, we talked about kind of how the plan comes about, all the work that goes into narrowing down those 3 priority areas. What are the next steps? What's that look like?
Right. So the next steps are more meetings for our stakeholders that are involved. And there's a very large group of stakeholders. So one thing we haven't mentioned is there are individuals from different facets of the community, like the YMCA, transportation, business and economy. It's not just a health department driven initiative, right? Our hospital partners are there. Mental health, individuals representing the recovery community. So we're all coming together. And the next steps really are to focus on the activities. So what are the activities that each of those groups can do to make a move on those objectives of the obesity, substance use, and mental health?
Okay. And that takes, I'm sure, quite a bit of work and quite a bit of meetings to identify, you know, what everyone can do, because then, as you mentioned, the goal is over the next 3 to 4 years to kind of move the needle in a positive direction, right?
Right.
Kind of making an impact in those areas.
Yeah, so the next step is we have a meeting on the 21st of November and, where we're all going to be in person and actually, you know, it's a working meeting, right? One of those meetings where you actually put down, what are you doing, or what my role would be, what am I doing at the health department already on these initiatives, and what can we do in addition? what is feasible for us to do. And I think every entity that's there will be doing the same thing.
Okay, wonderful. And if someone's listening to this and the priority areas that have been identified, they're struggling with one or multiple of those, what is the best way for that community member to reach out? I mean, is there a spot on the health department site where there's resources that, they could access right now? How would they go about getting information?
Right, so you can always contact us at the health department. So at our main line, our 987-5300 phone number, or our website is St. Clair County. I'm sorry, we just changed it.
It's okay. It's okay.
Because there's two websites going on. So the one for the CHIP is healthyscc.org.
Okay.
And that will give you more information on the community health needs assessment, the community health improvement plan, and all that data that's there.
Okay.
But also on our health department website, you can always email us, you can call us, you can contact us. We have a whole entire outreach department that could connect you with the services that you need if you're struggling in any of those priority areas.
Okay,
absolutely.
wonderful. That's good to know. Great. So in the short amount of time we have left, is there anything else that you think is important to share?
I think it's important for everybody just to stay in tune with the progress and what's going on, right? It's everybody's job to work as a community together to move the mark. Even an individual parent, family, student can really make a difference in the health of the community. And I think if you follow everything on the website that I mentioned, you can see how we're progressing, for sure, and offer opinions on it.
Yeah, wonderful. Well, thank you, Liz, for joining us today.
You're
I
welcome.
appreciate it.
Absolutely. Thanks for having me.
You're welcome. And thank you for tuning in to Spotlight. We hope to see you again soon.